The Inhub is a dry powder inhaler, or DPI, that contains multiple doses of medication within this case. Before using the Inhub, make sure the counter shows available doses. Do not prime this device. Hold the Inhub upright in the vertical position with one hand. With your other hand on this grip, lower the mouthpiece cover from top to bottom. Push the yellow lever down to the end of the purple arrows and you may hear a click like this. This will load the medication. Never shake the device because the fine dry powder may spill out. If you accidentally drop the device after loading the dose, then you must start over because the powder likely spilled out. Holding the Inhub upright but away from your mouth, breathe out gently but completely. Never exhale into the Inhub because you may blow out the powder or the moisture in your breath may gum up the powder. After exhaling away from the device, seal your lips around the mouthpiece, being careful not to cover the air vents with your fingers. Do not use a spacer with the Inhub. Inhale quickly and deeply through your mouth until you take a full deep breath in like this. Move the device away from your mouth. Hold your breath for up to 10 seconds or as long as possible. Then breathe out slowly. Push the mouthpiece cover up so that it's in the closed position like this, and the yellow lever will automatically be returned to the start position. Make sure the Inhub is shut and you cannot see the mouthpiece. If the Inhub contains an inhaled corticosteroid, rinse your mouth, gargle, and spit. Do not swallow to reduce the risk of thrush.